I'm Dr. James Cruz, Medical Director of Wayne Memorial Community Health Centers, and I'm here today to talk about safely reopening the schools this fall.
I'm Dr. Sean McVeigh, Pulmonary Critical Care Specialist at Wayne Memorial Hospital and also the Medical Director of the COVID Task Force. I'm here today to help collaborate with the local school districts on their reopening program for the fall of 2020.
You know, one of the most common questions I've been asked in the past couple of weeks is, do I feel like it really is safe to reopen schools in the fall? And the short answer is yes, I do. You know, looking at some of the CDC's guidance about it, they say you could safely reopen in-person school if there's not much community transmission, numbers are stable and they're low. And they particularly recommend the benchmark of less than 5% of your tests are positive. And we have that right now in Wayne and Pike County. In fact, over the past couple of weeks, our test positive rate has been around 2%. I mean, there are some challenges, but we've really been working on a safety plan. And I think we can do this safely. This is a respiratory virus. It is important to mask, hand wash, clean surfaces. The schools will be doing all of those things, maintain social distancing. But remember, this is primarily respiratory spread. Masking and social distancing are the most important things we can do, both in school and at home and in our community.
So the COVID virus, or the SARS-CoV-2, travels through aerosolized particles. Those particles are generated obviously when we cough and sneeze, but also we're continually generating particles just through the action of talking, breathing, eating, and doing those types of things. So what the masking does is it reduces the amount of those moisture particles that are being expelled from our mouth and nose into the general environment. The virus is rather heavy, and so its duration in the air is very limited, and we've estimated it to land on the ground or on a surface after about 6 feet of being aerosolized. Some studies have shown that distance can even be as short as 3 feet hitting the ground. So we know that using a mask and social distancing vastly reduces our risk of contracting the virus. The one point that I always like to make clear is that the cloth masks and the surgical masks that are widely available and are currently recommended to use will not protect me from getting COVID if that's my only measure of protection. The real purpose of wearing the mask is to protect everyone around me from those particles that I'm aerosolizing and ejecting. And the only way that masking works is if we're both wearing masks. It's also very important to wash our hands. Some people will say if you're out of the house and just at work or a place, in school or things like that, you should be getting in the habit of hand washing about once an hour. You should also hand wash any time that you touch a surface that you're not familiar with. So, using doorknobs to enter into or out of a room, sharing different things like you mentioned, papers, cups, pens, and things like that should prompt us to wash our hands. Anything that can have mucus on it, either visible or invisible, can also harbor the virus. And so particularly things that we're actively putting near our mucous membranes, like cups to drink from, should not be shared. The virus cannot be absorbed directly through our skin. So we can have contaminated mucus on our hands, but moving that into our face is how we actually get it into our system. Rehearsing the technique of proper hand washing. It's not simply putting soap on, running it under the water, and walking away. The virus is surrounded by a lipid membrane or a fatty membrane. And so that's what protects the fragile genetic material that's inside the virus. That's what gets into our cells and hijacks them to create more virus. Soap breaks up fatty membranes. But for viruses, it takes at least 20 seconds of emulsifying that virus and rapidly agitating the surface to get into all the nooks and crannies and break up that virus particle. That's only one of 2 steps. The second step is to thoroughly wash our hands to get the soap off, because the soap contains the virus particles. And so we want to ensure that we've properly rinsed all of that material off and either shake dry into the sink or pat dry on a surface that's on a substance that is going to be disposed of.
Vaccines are real important. We don't have a vaccine for COVID, but we do for a lot of other childhood illnesses. And most of the children have had the majority of vaccines, but one that really stands out is most children don't get flu shots, and those are really strongly recommended. And I think this year it's really even more important because flu tends to go around, it tends to cause a lot of illness. And not only can it complicate COVID, but it can be confused with COVID. So if your child gets the flu and winds up at home quarantined, waiting for test results from that when they really don't need to be if they have had their flu vaccine, that's unlikely to happen. So it really reduces the total number of sick kids and reduces the number of folks that have to either be quarantined or tested or evaluated.
Now, every virus has a different asymptomatic, or what we call incubation period. And for flu, it averages about 24 to 48 hours. For COVID, we've learned that incubation period could be as long as 5 to 8 days. And so during that 5 to 8 day window, somebody could be actively infected with COVID, producing virus in their upper airway, transmitting that virus, but showing or exhibiting no symptoms of infection. So that's what we mean by an asymptomatic period of time. Symptomatic is when you start to show the telltale signs that you're sick. And that's an elevated body temperature, it's that feeling of fatigue, or what we also call malaise, the body aches, a cough, increased mucus production. Also with COVID, we've learned that one of the actual early signs of the immune system being alerted or our body responding to the virus is a loss of the loss of our sense to taste or smell. In addition to that, we've seen headaches and GI symptoms that can include nausea, vomiting, and diarrhea. So it mimics most of the seasonal types of viruses that we see in regards to the symptoms. It's just that the onset from exposure to getting those symptoms tends to be much longer, and that's what makes this a more difficult virus to contain.
I think it's really important to have your medical plan in place before the beginning of the school year. Hopefully most of y'all do have a primary care doctor, a pediatrician, or family practitioner, but if you don't, you really need to establish one this year before the start of the school year. And if your student hasn't seen their doctor in a while, you probably need to set up a preschool and a checkup before school starts so that you're reconnected. Because if the child is sick, we would recommend calling your doctor's office.
The most important part to all of this is self-checks at home. And so it's rehearsing and asking the questions, how do I feel today? Do I have a headache? Do I have a stuffy nose? Do I have a cough that's new or different from my baseline? Does my stomach feel upset? Do I feel warm or run down? And also getting into the practice of taking temperatures and taking them properly. So, well, for the temperature, what we can define as a fever is anything over 100.5. But we know that some people naturally run lower baseline temperatures. So we also suggest that if you see a deviation of more than 2 degrees from your baseline, that should be a signal that something is changing or something's different in your body.
I think even little sniffles and runny nose, I would at least keep them home for a day and see if it doesn't clear up.
The one thing I could say now is to get in the habit of doing these practices, getting used to wearing the mask, getting used to, hand washing, scheduled hand washing.
For younger kids, maybe putting masks on their stuffed animals, playing with masks, getting them used to wearing masks, maybe even consider having a play date where they have some of their friends from school come over and everyone masked to get kind of used to this idea. You should practice good mask wearing as an example to kids. So they see a model of how it's done. Certainly wear your mask when you go out to stores, when you're out shopping, when you're out in public. But I would wear a mask if I have company coming over to the house, someone who's not part of my normal household, or if I'm going to see grandparents. I really think we should mask. We don't want to keep spreading this around to our loved ones. Thinking about the decisions for parents about whether or not they should send their kids for in-person school. I think a couple of factors weigh in. One of them is if you have sick adults in the home who are particularly immune suppressed or at particular high risk for COVID, you may want to consider doing online learning for your child. Or if your student has significant medical problems that would put them at high risk for complications related to COVID-19, you may want to consider online or some kind of virtual education for them. But I do think most kids can go back to school.
So as the medical director of the COVID task force here at Wayne Memorial Hospital, one of the three pillars that I've kind of said are core to us getting through this pandemic one is education. And so that's starting with these video series that we've collaborated with the school districts on, but also getting education from reliable known sources, CDC, World Health Organization, your family physician. The other is communication. Again, that's what the point of these videos and the hope of these videos is to communicate reliable information to the parents, to the children, to the teachers, and to the workers at the school, but also communicating back and forth amongst the teachers, the students, and the parents is very important as COVID changes, and it changes very rapidly. We learn new things about the virus. We get new measurements that tell us that the virus levels are rising in certain areas, so certain restrictions that weren't in place on one day may go into place in another. And that brings up the third pillar, which is flexibility. It's very important that we're all flexible, understanding that there's going to be change, and change is going to be sort of the ongoing theme as we continue to fight the COVID pandemic.
The data is very promising that if we do these things, we can keep transmission very low. And also, we at Wayne Memorial Health System are working with the schools, and we'll continue to work with the schools throughout the school year to help keep things safe. There may be changes in the plan as we go along, as new evidence comes out, as we see how things unfold. We have to be flexible, but we will be making decisions based upon the science to try to keep our kids and our community healthy.